Alright, this is everybody. 1, 2, 3, 4, 5, 6. 6. Who wants me to say it? You're all set.
Hi, my name is Maria. Today, I will present why the United States should adopt universal healthcare system. I begin with some facts about healthcare in the United States. This information is disturbing. Please pay attention. The United States currently has no healthcare system. 45,000 Americans die each year because they are uninsured, according to a recent study conducted by Harvard Medical School and Cambridge Health Alliance. 16.3%, 1 in 6 Americans has no medical insurance, according to the U.S. Census Bureau. According to the documentary SpCo by Michael Moore, between 2000 and 2006, wages in the United States increased by 3.8%, but the healthcare premiums increased by 87%. As an LPN and having worked in the medical field for 5 years, I have seen firsthand the difficulties and sufferings many uninsured people experience. I have a friend who ignored a persistent headache for years and procrastinated seeing a doctor due to lack of health insurance. When the pain became unbearable, he sought treatment, but it was too late because he was diagnosed with inoperable brain tumor and was given less than a year to live. Today, I will explain the current healthcare and why it needs to change. I will also present how we can have universal healthcare system. I will show how universal healthcare system coverage will improve not only your health, but make you richer and improve the prospects for our country. Lastly, I will show you how we can help each other attain universal coverage. According to the U.S. Census Bureau, in 2010, the percentage of Americans without health insurance reached 16.3% or 50 million. Insurance companies describe Americans as healthcare consumers. These companies do not form a system but a loose association. To insurance companies, healthcare is not a right, as it is in countries like France. It's something they sell for a profit. Their customers are asset because unlike purchasing a car, you never owned your insurance. The current insurance dystopia is a patchwork of for-profit insurance companies and large corporations that self-insure. The U.S. spends twice as much per capita on healthcare than other industrialized nations. Yet, in overall quality, its care ranks 37th in the world according to the World Health Organization. This is a slide showing the infant mortality rate. The United Nations ranked the U.S. as 34th in infant mortality, just below the communist state of Cuba, Northern Ireland, and Poland. According to the United Nations Human Development Report, countries spending substantially less than the U.S. have healthier population. Canadians live 3 years longer on average than Americans. Americans are slightly less healthy than their British counterparts. We have more diabetes, heart attacks, strokes, lung disease, and cancer. Even the poorest Brits can expect to live longer than the richest Americans. It just seems so unbelievable. We spend a lot more money for much worse care. Why is U.S. healthcare so expensive than other developed countries for much less care? Here's the answer. Administrative costs account for 31% of all healthcare expenditures in the United States. According to Los Angeles Times, the top executive at the 5 largest for-profit health insurance companies in the United States combined to receive nearly $200 million in total compensation in 2009. According to TakeBackYourMeds.org, 12 largest U.S. pharmaceutical companies made a profit of $34 billion in 2010. According to ABC News, profits at U.S. health insurance companies increased by 56% during 2009. In short, the reason our insurance system needs to change is people pay too much for insufficient care, or if they are uninsured, are just left to die. According to many sources, but most eloquently stated by Stephen Hill, a political writer, at the root of the grotesquely expensive and inefficient U.S. healthcare system is the fact that it is a for-profit system where corporations have incentive to charge premiums as high as they can get away with, while at the same time providing as few patient services as possible. The U.S. healthcare system prioritizes profits before people. This is why the system needs to change, to prioritize people before profits, to insure everyone. Right now, we have hundreds of payers called insurance companies. With universal health care, we can get rid of the insurance companies and replace them with a single payer. Instead of paying premium to private for-profit insurance companies like Aetna, Cigna, and WellPoint, we will pool all our money into one public insurance pool. This will cost us the same or less than we are paying now. We will save $400 billion a year in administrative overhead, waste, profits, and use that money to insure everyone, cradle to grave. Dr. Margaret Flower, a pediatrician and an advocate for universal coverage, says, "We have systems in the United States that could meet the goal of universality. That would be either a Veterans Administration type system, which is a socialized system run by the government, or a Medicare system, a single-payer, publicly financed healthcare system. We are already spending enough on healthcare in this country to provide high-quality, universal, comprehensive, lifelong healthcare. All the data point to a single-payer system as the only way to accomplish this and control healthcare costs." When universal coverage is implemented, you will get an insurance card, and with it, you can see any doctor or get into any hospital anywhere in the country. No bills, no copays, no deductibles, no more bankruptcies from medical bills, no more dilemma of whether to buy food or insurance. Universal coverage will save 120 Americans a day from death due to lack of health insurance. There are many benefits of universal health care. Universal health care is better for business and industry, especially small businesses, because it takes the burden off the employer to pay for employee insurance, and therefore makes American business more competitive than the rest of the world. A focus on preventative measure and early treatment for the people will increase the life and health quality of Americans. Universal health care will also allow people to have regular medical checkups so illnesses can be diagnosed early when the cost of treating them is low. Think about this. Why can all the other developed Western democracies administer a healthcare system, but the U.S. can't? The answer? Profit. Health is a quality of life issue. So the first thing we have to decide is what kind of quality of life we want in America. The current form of American health care affects the most vulnerable, the elderly, young, sick, and mentally infirm. The French have a phrase that I like. They say, health comes first. If the United States had a phrase, it would be, profit comes first. So what do we need to do? Lobby for universal health care in Hawaii. Contact your congressmen and senators and tell them you want a universal healthcare system in the United States. Watch the movie SpCo by Michael Moore, which is an indictment of U.S. healthcare. Talk to your friends, families. Spread the word about universal coverage. We're all in this together. Let's do this now. For our keiki, and our keiki's keiki. For our kupuna. universal health care for America now. Thank you.